Women at high risk of breast cancer face a vexing question. Should they have surgery to reduce their risk of the disease? Joining me today to discuss this issue is Dr. Raul Arroyo, Medical Director of the Kristen Hoke Breast Health Center at Jupiter Medical Center. Thank you for joining us. What kinds of surgery can actually reduce the risk of breast cancer?
Well, Kathleen, thank you for having me here. I appreciate the opportunity. There are some different forms of breast surgery to reduce the risk of breast cancer. One type of surgery that's used in two different contexts, I would say. So the one type of preventive breast surgery is used in patients who have had breast cancer and are looking to prevent future breast cancer. And another type of preventive surgery is done in women who have not had breast cancer. But it's the same surgery that's used in two different contexts.
And how effective are these risk-reducing surgeries?
The risk-reducing surgeries are effective in achieving that effect of reducing the risk. It is different for women who are doing it in a preventive fashion, never having had breast cancer, and women who have had breast cancer and are seeking to prevent future breast cancer. There's a difference between the two. But the surgery itself is effective in preventing a breast cancer from developing in the breast.
You almost can't discuss this topic without talking about actress and activist Angelina Jolie. And she underwent a double mastectomy at the age of 38. She was very public about her surgery. For those who may not be aware or don't recall, tell us what her situation was and what led her to that decision.
Sure. Well, Angelina Jolie, she had a very particular finding that she tested positive for a breast cancer gene. So she did not ever have breast cancer, but she did have, was identified at a high risk for breast cancer based on carrying a genetic mutation. So in her case, she had preventive surgery, never having had breast cancer, and what she had was a bilateral or both sides breast removal. Particularly, she had what's called a nipple-sparing mastectomy, which is where the breast tissue is removed from underneath the skin while preserving the skin and the nipple intact.
And now, did she go on later to have her ovaries removed as well?
Yes, she did have her ovaries removed as part of her preventive treatment because her particular genetic mutation, the BRCA gene or the BRCA genetic mutation that she carried, also carries an increased risk for ovarian cancer. So she did her breast surgery and the ovarian surgery to reduce her risk of both of those cancers.
And now it's been about 3 years, I think, since her story made headlines nationally and really around the world. And since then, doctors have been noticing what they call the Angelina effect. What is that, and what have you seen in your own practice?
Yeah, definitely since Angelina Jolie came out with her diagnosis and her choice of treatment, definitely there has been an increase in women presenting, desiring to have both breasts removed at the time of surgery. Now there's a big distinction, and that's what we've seen, is that women with breast cancer are requesting bilateral mastectomy. Again, thinking about Angelina Jolie and how she was treated, but it's a very different situation in the sense that the benefit of a prophylactic, or I say a proactive mastectomy, has only been shown in patients who have a specific inherited mutation of the BRCA gene. Those patients have been shown to have a survival benefit by proactively removing their breasts. Patients who have been diagnosed with breast cancer don't necessarily have an improved benefit in survival by removing the unaffected breast, or what we call the contralateral breast. And that is a very common misconception that women believe that they're improving their odds of survival from the present breast cancer by removing the opposite breast.
Are you concerned that there are women out there who are actually undergoing this contralateral mastectomy, perhaps needlessly?
Yes, it is definitely a concern, and there are a large number of surgeons who really try to educate the patients in regards to that, because the incidence of the gene, the breast cancers that are caused by this genetic mutation, is in the neighborhood of 10%. So really it's only 10% of the women who have this degree of high risk of breast cancer. So the other 90% of the breast cancers don't necessarily have a benefit by removing the opposite breast. A lot of women who have breast cancer and undergo breast cancer treatment in their lifetime would never develop another breast cancer in the opposite breast. So there is a certain subset of women who will benefit from surgery of the contralateral breast, or prophylactic contralateral mastectomy is what it's called. But there's a larger number of women who don't derive that benefit.
Do you think that it's fear or awareness that's actually driving women to ask about contralateral mastectomy?
I think it's both fear and awareness that drive patients to ask about the contralateral mastectomy or prophylactic mastectomies. And I do think that there is definitely an advantage to having had somebody so public as Angelina Jolie undergo something like this, because it has created an increased awareness of breast cancer in general. So there is an increase of women who inquire about that as an option for treatment, and what it does, I think the advantage is it then brings them into the physician, and then the physician's job to educate the women to see who really will benefit from similar type of surgery as Angelina Jolie and who would benefit from something less.
Do you think that physicians in general are doing a good job at this education?
I think overall, the job that physicians are doing regarding educating patients about this topic is good. It interestingly varies geographically. There are some areas where there's an increased number of women undergoing prophylactic mastectomies of the unaffected breast, and there are areas where still breast conservation is practiced more often than the opposite, than mastectomy.
And in your practice, which women do you actually advise to consider surgery in order to reduce their risk?
In my practice, I advise certainly women who have tested positive for the breast cancer gene, whether it's before ever having had breast cancer or after. I will counsel them, and not that everyone will need prophylactic surgery, but for the greater number of those patients, they may end up with that choice. Also, women who are diagnosed at a very young age with breast cancer, some of them may benefit from prophylactic or preventive surgery. Women who have a very strong history of women who have a very strong family history of breast cancer, but didn't necessarily test positive for the gene, some of those patients are considered for preventive surgery as well.
And what can women who are at high risk do if they don't wish to undergo surgery?
Well, women who are considered at high risk or increased risk have options. They don't all necessarily need surgery. There are some women who opt for close surveillance. There are medical options to reduce the risk in addition to then close surveillance. So not every woman who is at increased risk needs necessarily to undergo surgery, nor do they. So there are women who will follow this closely and act should there be a change.
Do you find that those other options are equally as effective?
The medical options for reducing the risk of breast cancer are effective in the right patient. And that's where it's important to seek advice from a professional in the field who's very well versed in that, to put the right patient in the right treatment. And certainly the right patient treated medically can fare very well. So it is absolutely a good option for many patients.
And what are the potential harms if someone, the risks or the harms of undergoing a surgery like this? I mean, it's major surgery.
Yes, there are certain risks and complications that can be associated with preventive surgery. And what I find is a lot of women come in with the expectation that they're going to have their surgery, have reconstruction, and look and feel the same as they did before surgery. And studies have shown that when women undergo preventive surgery, a great majority of them are very satisfied with their choice to do the surgery in a sense of reassurance and feeling that they have done something proactively for themselves, but they find they're less satisfied with the results, either cosmetically or in how their breasts feel. They didn't anticipate the results that they got. So that is something that, again, the professional is, it's something that their healthcare provider really should explain to them and make sure that they set the correct expectation, so that after the surgery the patient isn't disappointed or surprised with the results.
And after they have this surgery, are they still someone who needs to be under increased surveillance for developing breast cancer?
Yes, even after preventive surgery, because patients need to continue follow-up to make sure that they do not develop a breast cancer. Our best efforts at removing the breast tissue will remove about 95 to 98% of the breast tissue, but it's not 100%. And the nipple itself is breast tissue, which a lot of women aren't aware of. So they're still at risk for developing breast cancer. It's much reduced after mastectomy, but it does not go to zero. So there is follow-up that is necessary. The imaging that we do oftentimes will change. A lot of women won't need certain types of imaging, but they do need certainly continued surveillance.
And how do you support a woman through this decision? I mean, I just can't imagine how nerve-wracking and what a difficult decision that would be. How do you and your team support women through that choice?
Well, the way we support women through the choice, and indeed it's a life-changing event, and to be faced with that diagnosis and then the specter of, oh my God, what do we do next? From night to day, because one day they're fine and the next day they're already being faced with the potential of having both breasts removed. So it is a very emotional and very charged situation. So we're very blessed, especially at Jupiter Medical Center, that we have a multidisciplinary team approach to this. And women can find support. We have support in place with resources not only for the patient but as well for the family. We have social workers that work very closely with the patient. We have a nurse navigator who is in constant communication with the patient. So whenever there is any concern or any worry that the patient has, that there is an avenue for that to be communicated to the providers. And then we have the resources to address them, whether they're psychological support, we have medical support, imaging. So the whole team approach is really beneficial in reassuring the patient that she has a safety net, that she does have a team behind her to support her through the process. So it's something that we work on very, very diligently. In addition to, we have, as a way to support women through this process, a survivorship program, so that after the whole surgical experience that we just don't let the patient fend for herself. There is follow-up, there is a plan for follow-up, so that after her care, the treatment doesn't end, the support doesn't end, it's still there.
It's wonderful to hear that you have all those resources for patients. Thank you, Dr. Raul Arroyo, Medical Director of the Kristen Hoke Breast Health Program at Jupiter Medical Center.
Great. Thank you very much.